Why wouldn't someone want to live here? It's the cleanest, most beautiful place on the planet to live, but it has to be affordable. Look at the demographics that we're facing now. We're an aging state. We're getting older faster than most places around the country. We're losing our working age population because it's not an affordable place to live, work, and raise a family.
Vermont is paying more for health care at twice the rate of the national average. Costs are way out of control, and it is becoming an economic burden for Vermonters.
It's not just a matter of individuals paying their premiums or paying for care, it's taxpayers too.
We pay the most in health insurance premiums of any state in the country. We're about twice what they pay in Maine, 2.5 times the national average.
Why do we have insurance health premiums the way that we do? What is it that's driving these rates? And we know that if we keep peeling back the layers of the onion, we will continue asking why and getting to the root cause of that.
An expert last fall reported kind of on the health of our health system and the hospitals, and started by saying, if you don't make changes, Vermont is likely to need to subsidize hospitals to the tune of $1.5 billion.
We have one major health insurer in Vermont, Blue Cross Blue Shield. It reported a $62 million loss last year. It's in very precarious financial situation, and we need to make sure that it survives because it provides coverage for most people in our state.
We have a coalition that is diverse by geography, political perspective, industry sector. It is an array of people who represent segments of our population who have been directly affected by double-digit increases in their health insurance premiums.
We were sort of motivated to come together and answer this question: what is going on, and what's driving this, and how do we ultimately make a change so that our costs get more in line with national averages? And what we're seeing is, more often than not, it comes back to very expensive hospitals. And when you dig into that, it comes back to not expensive labor rates or too much personnel caring for patients. What's really off the charts is administration and management labor costs. So we have too many bureaucrats. We'd like to see more people caring for patients. And we need to correct the top-heavy dynamic in our hospitals, particularly our largest hospital.
Number one, be informed. Go to our website, find the data, which we have built based on publicly available national data sets. Number two, speak out and share this information with your friends and with your own social networks. Speak to people in spheres of influence. Talk to your legislator. Send a letter to Green Mountain Care Board so that they understand what your interests and needs are.
We need to raise public awareness. We need to provide support to the health insurance and healthcare regulator, the Green Mountain Care Board. We need to make sure that public policymakers are aware of this challenge. So we want more and more Vermonters to speak out, because if we don't, the trajectory is not very positive.
But if Vermonters come together and stand up and demand that, we can achieve that. We've already seen a quick turnaround, and I have every confidence that we can do this if people come together.
Get smart, be motivated, speak out.